At this point in the semester, you've covered a lot of territory, many ideas and theories. I think it might be helpful if I offer you a reflection about how you might put things together in a meaningful way if you're finding this to be a bit confusing and are experiencing a bit of ambivalence. There are many disparate theories, some of which I've added, like the concern about spirituality. We talked about spiritual emergency, and I think those are important to understand when you're practicing, because sometimes people misunderstand a spiritual emergency perhaps as some kind of serious psychopathological process. You've overviewed psychoanalytic and psychodynamic theories, have explored ideas of Rogers, Ellis, and Pearls. Next, you considered existential and transpersonal concepts, and currently you're probably looking at the cognitive behavior and CBT material. So you're probably asking yourself, so what, with all of this? How do I make sense of this material? I hope to address some of these concerns in this lecture midway on the road through the semester. Hopefully this will help pull together some things if you're still kind of confused. This exercise is an example of what Scott Miller calls deliberate practice, and it's something I hope you will do throughout your career. It's a space where you step back, take a breath, and look at the territory from a different angle. As he says, this is what one does outside of the therapeutic setting that enhances your work. In other words, it prepares you to be more adept and able to help your clients. So along with this idea, I want you to consider what I call the big R and little r reality. It's kind of a metaphor, but I think it makes sense in terms of what we're looking at and how you would bring about you'd extrapolate certain theories into your practice. When talking about the big R with regard to evidence-based clinical social work theory, I'm discussing the global level. That is, the place where all theories and possibilities are contained. This I call the big R. In other words, this would be the global container of all possible theories that one might use with clients. And as you see, the hands indicate what we're going to next, that I call the small r reality, where individuals who have particular perspectives take from the global ideas into their own practice. So here we have the small r, and that is the level at which each of us develops our own ideas and therapeutic style as we extrapolate from the big R what works for us in our practice. So here would be an example of yourself having extrapolated from the big R those elements that you want to use in your practice, and then here you are with the client in practice actually utilizing what you've elected to adapt. So this sort of parallels this idea of the hologram, and so that's the reason I'm showing this picture of the hologram, because that sort of depicts what the big R may be like in terms of depicting it. It contains all of the possibilities. It's kind of the global approach to whatever we may be talking about. Specifically, in this case, it's evidence-based clinical social work theory. Then the next image here, the hologram is, it's said that if you break a hologram into 1,000,000 pieces, each of the broken shards together can reconstruct the whole. And so that is like, the shards would be like each of us individually with our perspective on the big R. In other words, each of us has a different way of seeing that reality based on our life experience and our understandings of the world around us. And this is brought about, again, by our being in the world and our experiencing the world. This next slide, we're looking at all of the theories that you've looked at so far this semester, and then certainly there are ones that you're going to continue to be considering over the next number of weeks. But basically, here are the theories like psychoanalytic or existential or Gestalt. In other words, the theories are here, and you will be looking at them and trying to determine which ones fit with your approach. In other words, what resonates with you in terms of the practice that you're going to be doing. So you'll explore the use of self in practice as you bring with you your life experiences based on your own temperament and the theories that have resonated with you as you've explored course material. So that's partly the reason I put together the academic journal that I don't attach any points to, because it helps you find a place to contain and reflect on the range of ideas that have come to you this semester, and then also having you have the opportunity to punctuate those that seem to be the most relevant to your approach to a practice. And so, in essence, this slide 8, this puzzle concept suggests that these are the ideas and techniques you will use in your practice. And this is the reason I put, as I said, the journal together. And you must remember that all the theorists you're studying have gone through a similar process that you are in the development of their ideas and practice. We must remember that all theories build on previous ideas and theories, and that Freud and Jung and the others went through a similar exercise that you are today, or perhaps back then there weren't as many theories to explore, but certainly there were ideas and different perspectives. I mean, based on the theorist's own life experience, Freud came with a particular approach to physiological kind of elements, where one of the female therapists, either Klein or Horney, was looking at elements of the maternal, the breast, I believe one of them talked about as an example. Gestalt theory comes from a particular worldview on the part of Fritz Perls as he developed that based on his life experience. So as you've looked at the experience of the theorists, you can kind of see where things link to how they ended up doing the kind of work they did. Ellis is another example. He was much more of a didactic teacher in his approach, as opposed to, say, Carl Rogers, whose approach was much more humanistic in terms of how he came at his work. So each of you will have a different worldview, and that worldview and life experience will suggest the kind of theories that you find most applicable in your way of doing things. 9 here has each of us standing down at the bottom reflecting on practice and bringing the self to practice and utilizing your talents and skills is a real learning part of beginning social workers as you go out into the world as an MSW. Of course, you bring your ideas, and your ideas about human nature, I think, are really important in terms of how you will relate to your clients. And you will have extrapolated a number of theoretical methods and skills that fit with your personality, and your small r perspective of the big R will allow you to comfortably use what you find favorable in your practice, but you'll also be aware of other techniques that may be applicable in some cases to clients that may be different than what you're comfortable using, but that based on what you've studied, will be helpful to a particular client. And there's so many different people that we may see in our practice. The beauty of social work is that we're more of an eclectic profession, where we utilize what is going to be helpful to the client as opposed to just what we embrace as the method we may favor the most. And then this slide is a metaphor for your, again, self in practice. It's your temperament, your unique worldview, the self you will present to clients as you help weave their stories into healing experiences and newfound insights about their lives and their circumstances. And you will provide them with hope and empowerment, of course, to change, to move toward the solution, whatever it may be, to a given situation. This slide is particularly interesting in that it looks at weaving innovation and evidence together. In a sense, it's like the art and science of social work. Both together are a holistic way of working with individuals that have the most potential for success, in my opinion. So here you have what we have in the evidence-based world that suggests that things work, and then we have kind of the innovation the artistic element of what you're going to be doing in your practice. And no matter what level of practice you engage in, you will find that there are the elements of the two that can very well weave together successful outcomes for your clients in a range of settings. And then, of course, by listening intently to your clients' stories, you will assist them in weaving together purpose and meaning in their lives. One of these elements here I like is the idea of resilience and advocacy. Not only advocacy for the client, but advocacy toward the client, advocating the client to become more empowered to do what it is that needs to be done, and also seeking past experiences that help build resilience in the current moment of the life space of the client, whatever their struggle might be. Certainly the strengths perspective is an important element here. And you will be providing care, resilience in the face of adversity. You will ask them to embrace that in whatever way possible, envisioning an outcome that enhances their lives. Because having a clear picture of where one is going, I believe, is very important in order to be able to have the energy to be drawn there. And that's one of the reasons why I like using art with clients as well. It's metaphors that help clients resolve issues and experience healing on a below the surface kind of level. And then the image here is not necessarily what it says, but I like the flow of the picture in terms of your work during the next year, because you're going to be going through a couple more semesters in the master's program, and you'll be experiencing courses in clinical practice with individuals, families, groups. And these courses will allow you to explore your favorite ideas that you find this semester as you apply your tapestry of ideas, theories, methods, and skills in the safe harbor of the classroom this fall and next spring, and even perhaps in your field placements. As you approach your deliberate practice, both now and in the future, this lifelong learning element will help you continue to weave your tapestry of theory and practice and develop skills that will make you more able to help clients move toward their positive outcomes. As time goes on, you will look back and note your perspective over time has changed, and this will be based on your experience and practice with clients. So, if you look back in 5 years, you're going to see that you have a much different maybe approach to what you do as when you leave the program next spring. And then, of course, the last slide transitions to the present time, and this tapestry idea I like in that you will be individually adding your own perspective of the big R in your group. So your small r perspective will be entwined here with the other students in terms of the theory that you decide that your group is going to more in-depth study for the presentation. And remember to attach a timesheet that shows each member of your group's contribution and the time that was spent consulting and preparing the presentation that you do with your colleagues this semester. As you move forth the semester, I wish you every success as you continue to try to weave into your approach those elements that you favor in what you're studying, but also be mindful of those that you don't necessarily want to include, because in the future at some point you may find some elements of those theories useful given certain clients that you may encounter. So have an enjoyable time preparing the presentation, and I wish you all well as you continue this semester in the program.